Hi, my name is Joe Pecora, and I'm Vice President of the Home Healthcare Workers of America.
Woo!
Hi, thank you. Thank you. I'm proud to stand here on behalf of our amazing members and our international union, the IUJAT, with elected leaders Eric Adams, Donovan Richards, Adrian Adams, Sylvania Brooks Powers, and Francisco Moya, who all know the value of the home healthcare industry. This has been a unique year for our healthcare systems. Our 30,000 strong membership has witnessed firsthand the health risks associated with working on the front lines during the pandemic across all 5 boroughs. Today, more than ever, families are making decisions for their loved ones who are elderly, infirm, who have special needs, who might be better off within the comforts of their own home as opposed to being in an institutional full-time nursing setting. And our members, mostly women, are the caregivers that make that happen. The dedicated members of the Home Healthcare Workers of America worked every day of the pandemic, going into people's homes, caring for their wellness needs, providing food, bringing them to medical appointments, but most of all, providing necessary companionship, and being perhaps the only daily wellness check at the door, which was critical to the over 100,000 people we serve, especially during the long isolation of the quarantine. Many times throughout the pandemic, our workers quickly evolved from being physical to emotional caretakers. As a union, we are aggressive in advocating for the needs of our workers. In the last year, we've taken that message to Albany, City Hall, and Washington, D.C. to support funding for scarce PPE and hazard pay. The next 4 years will chart the path for the city in a way I'm not sure any 4-year period has. The recovery from COVID is a major piece, but so too is public safety. So is public transportation. So is dealing with housing issues. So is making sure that small businesses are able to stay open and function. Eric Adams has a plan to address all these issues. As well as the experience. He knows how to translate that experience into results. We are proud to endorse Eric Adams for mayor. On public safety, one of our biggest concerns is crime on the subways. We need a mayor that understands public safety and can help make this city's neighborhoods safe again. Eric Adams has worked with many healthcare professionals in his career and understands the important role they play in making our society a better and more equitable place. As our profession grows, we need the type of leader who can recognize and understand the challenges we face. This is also a man, when challenged with his own health issues, tackled them head on. He didn't find the easy way out or seek a shortcut. That is illustrative of the work he's ready to put in and necessary to achieve results. He knows New York, having grown up in Queens, serving over 20 years with the NYPD, as an aggressive advocate for black leadership and law enforcement, playing a more prominent role in the city. His record in the state legislature and as Brooklyn Borough President shows a clear commitment to New Yorkers. And we have great confidence in his ability to lead this city forward. HHWA is proud to stand with Eric Adams, Donovan Richards, Adrian Adams, Sylvania Brooks Powers, and Francisco Moya, and we strongly encourage all of our members to rank them number 1. Now, it is my pleasure to introduce New York's next mayor, Eric Adams.
This is such a significant endorsement. I'm sure our Queensborough president, Donovan Richards, and our great councilwoman, Adrian Adams, my Bayside High School alumni. Councilwoman Sylvania Brooks is also coming. This is so important because as we engage in this campaign, when I speak with the borough president, and both the council persons, we're talking about the same things. We're talking about how do we finally end the inequalities that really holds back everyday workers. All of us are stating we're going to come together as a team and look after those workers that are looking after the most vulnerable population in our city. You know, my mother had a home health care worker, and it was unbelievable how she went beyond the call of duty to make sure that my mom was comfortable, make sure that all those things that are not listed on the job description is actually carried out. So we must ensure that when the hazard of COVID hit this city, they stood up as heroes, so they should have the hazardous pay that comes with it. That's why I have my people's plan. How do we ensure universal child care? How do we look at our earned income tax credit to put $250 a month in the pockets of low earning income New Yorkers? How do we lift up and increase the number of people who are part of the reduced fare MetroCard program? How do we find real ways to put money back in the pockets of men and women like this important group of employees here? So I want to say thank you for this amazing endorsement. It means so much to me. It really signifies my blue collar stamp of approval. I'm a blue collar candidate, and I'm going to be a blue collar mayor to fight for the working class people in this city that far too often they're left behind, they're forgotten about. We don't understand how imperative it is to have them until we have something like the pandemic we're starting to cycle out of. They were on the ground. When others fled, they led. I saw them on the trains. I saw them walking the streets. I saw them going into the homes to take care of those who are in need. This means a lot to me. And we just did an analysis, a report. I have received more support from everyday folks who are in the healthcare industry, such as this amazing industry, than any candidate that is running. I'm the healthcare candidate, and this endorsement furthers that. Thank you so much.